In our medical news today, more than 750 health department staffers are speaking out against their new boss. Current and former HHS employees sending a letter to Secretary Robert F. Kennedy Jr. and Congress, urging him to stop spreading inaccurate health information. The letter says Kennedy is complicit in dismantling America's public health infrastructure by questioning CDC's workforce and making false claims about COVID vaccines. It comes after a gunman fired more than 500 rounds at the CDC's Atlanta headquarters back in August, earlier this month. An attack authorities say was motivated by the shooter's discontent with COVID vaccines. It's not unusual for students to not always look forward to getting out of bed each morning to head to school. Can't blame them. But if they want to avoid the classroom on a regular basis, experts say something else could be at play. In today's Health Minute, Mandy Gaither has the not so obvious warning signs of emotional distress in parents and what you can do about it.
It isn't always easy getting out of the door for school, and while experts say it's normal for a student to not want to head to class every now and again, when it becomes a pattern, there may be a problem.
Maybe it's that they're not fitting in at school, they're experiencing bullying or just nervous about socializing. It may be a sign of a mental health concern like anxiety or depression. It may also be that they have a learning disability that hasn't been diagnosed yet.
Pediatric psychologist Ariana Howitt with Nationwide Children's Hospital says emotional distress may not look the same in children as it does adults. Warning signs may include behavior changes, tantrums, irritability, and anger. There may also be physical symptoms like stomach aches, headaches, and nausea, which could also signal a mental health concern like anxiety.
As parents, we want to often shield our kids from those difficult emotions. What happens though is if we let a child avoid, stay home from school, it actually makes the anxiety grow.
Instead, Howitt encourages parents to sit down with the child and get to the root of the problem. Validate what they're feeling, let them know you understand, then work together to problem solve.
If a child is feeling nervous about, let's say, socializing with others, then we practice those social skills at home. We practice them out in different environments so that when they do them at school, they feel more confident.
She says the more experience a child has with something that's scarier, the easier it becomes to manage that worry.